Hey Adam, so today we are going to be talking about aeromedical factors. Um, First things first is first thing we need to know is how to get a medical. How you do it is first you want to go to this website right here. You want to first go to a designee search up the FAA. It's pretty easy. All you do is go to FAA AME and it'll take you to this website. You search up the aviation medical examiner. That's what AME is. That's the person that can take the test for you to get you a medical. You'll find one of those, call them up, schedule an appointment, and then prior to your appointment, you want to make sure that you fill out this Med Express application, which basically is an FAA thing that allows your AME to see your medical history of stuff that you input and as an application for you to get a medical. And that's also located on the FAA website. Now, ways to get around to still get a medical with deficiencies. So the first one is what's called a SOTA, which is a statement of demonstrated ability. It is basically what happens is say you have medical and you get I don't know, you lose a finger or something like that, and you're still able to fly or do something. What happens is if you have a deficiency that will cancel your medical, you can go up with a DPE usually. That's how it works, and you'll call up the FSDO, and they'll set a schedule up with a DPE. And basically, you fly with a DPE, and he makes sure that you're safe and that you can safely operate the aircraft and fly with that medical deficiency. And this, if you pass and he signs you off and lets you say, "Yep, you're okay to fly," it'll last until it won't expire unless your symptoms they get worse. That is one way to do it. Another way to do it, say you have a medical, but then all of a sudden you now have diabetes. What you can do is, as long as that deficiency is stable, you can get what's called a special issuance authorization, which basically is saying that which basically allows you to have your medical with this deficiency. The FAA has a list of 15 deficiencies or more that are actually listed in the regulations that will prevent a pilot from getting a medical. One of those being diabetes. It's a really common example because pilots, as long as they can go to their doctor and as long as they can show that this deficiency is stable, that it won't cause harm to it, and they go through special testing from the FAA, they'll issue this authorization. The FAA will on their medical certificate, allowing them to fly. One thing I forgot to mention is, let's say a pilot that has once had a medical, has lost it or has expired and wants to still fly, but knows he cannot get a new one. He can go to his state licensed physician every 48 calendar months, and as long as the physician signs off saying that this deficiency, that he's okay to fly with this deficiency, and he completes an online course, the pilot can still be able to fly. However, when you're flying under basic med, the pilot also has certain limitations as well. Now, moving on to some factors that affect pilots while flying. A major one that we all can experience when flying at higher altitudes is what's called hypoxia. This really can affect pilots and is very dangerous if not noticed quickly enough. And basically what it is, hypoxia in general, is a reduced amount of oxygen to the body. There's 4 different types of it: hypoxic, hypemic, stagnant, and histotoxic. What happens is that those four different types are kind of like how the oxygen is not reaching the body. The first one being, which affects pilots the most, is hypoxia, which basically is that oxygen, there's an insufficient amount of oxygen available to the body. So oxygen in the atmosphere, it's 78% nitrogen, 21% oxygen, and 1% other trace gases. This remains constant throughout the atmosphere. However, when pilots are flying at higher altitudes, especially above 18,000 feet, where it's half the amount of pressure that is at sea level, pilots can really expect to feel the effects of hypoxia at around above 10,000 feet. But the higher you go, the less pressure is reaching, the less amount of pressure is reaching your lungs. And as well as there's not enough oxygen molecules are in the atmosphere in order for your lungs to inhale. And that's because the pressure is less, the air is less dense, and so all the molecules are spread out a lot more. There's not as much in the air, and so that's why when you're flying at higher altitudes, even if you breathe in normally, you're receiving a lot less oxygen, and that's why it's so hypoxia is so common, is the most common type of hypoxia. The next one is hypemic hypoxia. So hypemic hypoxia is where there's not enough blood, or the blood is not able to carry the oxygen where it needs to be. So if there's not enough blood cells in the body, you might have enough oxygen. However, because of the lack amount of blood, say you're anemic or you have excessive blood loss or you just made a blood donation, then your body can't carry, doesn't have enough molecules or blood cells to carry the oxygen where it needs to be. Another type of this is, say, the hemoglobin in your blood, which is the oxygen carrying molecule, cannot combine with the oxygen. So it just can't carry it. One type of this is, say you have carbon monoxide poisoning, or which affects the hemoglobin and the ability to carry that oxygen to where it needs to go. The next type of hypoxia is stagnant hypoxia, which basically the blood is not able to move. So the blood can bind it, there's enough in there, the oxygen's there, but there's no blood flowing, which comes from the word stagnant, not moving. So the blood is not able to move the oxygen to where it needs to be. One example of this is, say you're doing acrobatics or aerobatic maneuvers, and you pull a really high G maneuver. So you pull 6-7 Gs. That blood is not able to move because of the high amount of G force that is experienced. So people can experience that type of hypoxia, which is why sometimes you see, say you're what's called a G suit, and basically it keeps, say aerobatic pilots, they wear like G suits, which keeps the blood like up and not down at their feet, and it keeps it where it needs to be. The last type of hypoxia is histotoxic, which can be it's basically is the inability for your cells to carry that oxygen. So histo meaning cell and toxic meaning poison, meaning that that's where that comes from, and basically your cells aren't able to carry that oxygen, and most of the time this is from alcohol or drugs, which will which will decrease and make your cells ineffective in carrying that oxygen where it needs to go. Some symptoms and treatment to hypoxia. So the first type of symptoms that every pilot will experience is the feeling of euphoria and being carefree. Once oxygen is as starvation occurs, that's what most of the pilots will feel. They'll feel everything is fine. Everything is everything is just cruising along. However, they're losing situational awareness. They're not feeling. They're not actually maintaining control of the aircraft, which is as it continues, they can become less responsive and can lose coordination of the aircraft, as well as even time continues. Some main symptoms, this can vary from individual to individual, but you can have cyanosis, which is blue tipped or blue lips, blue tip fingers or blue lips. You can have a headache, decreased response to stimuli, and an increased reaction time. An impaired judgment, euphoria, visual impairment, drowsiness, lightheadedness, and tingling in the fingers and numbness. And I included a link to show like the effects of it. There's this pretty popular video I've seen throughout all my training, and it's basically this pilot goes up in a what's called it's called a what's it called? It's a chamber that decreases the oxygen in the air. I can't think of the first name, the actual name, but basically he goes up and they decrease the oxygen, and he just tries to name off cards, and he can't even name off a four of spades. He keeps on saying like a three of hearts is a four of spades, and he loses, reaction time, and it shows the effects of hypoxia. And as well, because they have that sense of euphoria, they also can create a sense of security. So even if once they start increasing the symptoms of hypoxia, they don't know what's occurring, and they just feel like everything's happy going, and they feel fine, that everything is great. So the way you can treat hypoxia is to, first off, you can either fly at a lower altitude where there's more oxygen in the air available to you, or you can use supplemental oxygen as well. And basically, those are the two ways to do it. As long as you're following, say if you're in an unpressurized cabin or pressurized cabin, you have your oxygen rules, and which I won't go into, but and as well as say as long as even at 20,000 feet, basically what happens is as soon as you start to lose oxygen, you start to have oxygen. The higher you are, the less time that you're conscious enough to actually do something to counteract this fight. This was what we call the time of useful consciousness, and as the higher you go, the less time you have in order to be conscious without using supplemental oxygen. And fighting hypoxia is pretty dangerous, but the main way to do it is to fly at a lower altitude. The next factor that we'll get into is hyperventilation, which is an excessive rate of respiration in the body, which results in a lack of carbon dioxide in it. Usually with this, people that experience this will have an increased breathing rate, as well as an increase in anxiety, usually because it comes from, say, a stressful situation. Pilots pilots flying in the majors, if they experience it, are even susceptible to this, because if they experience a stressful situation, even they can have an increased breathing rate, even to the point where, say, even a passenger, especially a passenger, can be really susceptible to this. But even pilots as well, because as long as they increase that breathing rate, So what happens is they lose a lot of carbon dioxide really quickly, and the symptoms of this could be similar to hypoxia, a little different, but sort of the same. You know, they have a visual impairment, unconsciousness, lightheadedness, dizziness, tingling sensations, hot and cold sensations, and muscle spasms. So pretty similar to hypoxia, but a little different. And as well, in order to treat this, what they can do is they can just, breathe at a normal rate. That's all it is. It's just an increased breathing rate. And as long as they start to realize it and breathe at a normal rate, they'll they'll get their carbon dioxide level back pretty quickly. It subsides pretty quickly once they start breathing normally. But in order to help that, say they can't breathe normally, if they breathe into a paper bag, which say you just if you're breathing into a paper bag, you just exhaled carbon dioxide into the air. So you're breathing that carbon dioxide back into your body, exponentially increasing the amount of carbon dioxide in your body, as well as talking out loud, which will slow the breathing rate and as well as counteract the effects and help stop hyperventilation. So the next factor that we're going to talk about is your middle ear and sinus problems that can affect pilots during flight. So inside your body, you have free gases that, especially for us, are inside your sinuses and inside your middle ear. What will happen, say during a climb or descent, the pressure outside of your body is, say you're in a climb, is going to decrease with altitude. So what will happen is the pressure is going to want to equalize. When this happens, your gases escape the body, like through these cavities, like your middle ear and sinuses. They'll escape the body, but if it's impeded, it'll cause a lot of pain in the area that it is being impeded. So say for your middle ear, what will happen is you have pressure, you have air inside this middle ear, and you have air outside the ear. As you're in a climb, when you are climbing, the pressure outside of the ear will be decreased, and the pressure inside the ear will be increased compared to the outside air. So the pressure inside the air is going to escape through the outer ear, from the middle ear through the outer ear, and it will expand the eardrum. However, when you're in a descent, the reverse happens. So the pressure of the outside air is higher than the inside air, and then the inside ear, because at the higher altitude the pressure equalizes. So this has less pressure, this has high pressure. Pressure flows from high pressure to low pressure, and so the air outside and the outer ear will want to come into the middle ear, and it will bulge the eardrum inwards. How this is usually fixed is through the eustachian tube, and so the eustachian tube will expand. Say when you yawn or chew food, then this expands, which equalizes the pressure between the outside and inside ear. However, during a descent, this is really difficult sometimes could be very difficult to relieve, and also the symptom is very difficult to relieve because there is a vacuum that constricts this tube from opening, and so also when your eardrum bulges in, it is not a fun experience. It hurts if that pressure can't be equalized, and so that vacuum is created so where the eustachian tube can't open to equalize that pressure. And this is so how you would stop that is if you would to say close your nostrils and your lips and then blow air through it. It'll basically force air through that tube so that the pressure can be equalized. However, say you say you have a congestion problem or an upper respiratory problem, it could be almost, you may not even be able to relieve that because of the congestion that'll block the tube from opening or closing. So similar to your middle ear is your sinuses. They work the same principle as your gases, trying to equalize the pressure inside and outside your body. Except your sinuses, they go through small openings that connect through your nasal passage as well. However, unlike your ear, you're gonna experience that. You can experience that middle ear thing regularly because your eardrum is blocking that. But if, say, you have an upper respiratory system or an upper respiratory infection, or say allergies, that actually builds that congestion, which will block that gas from escaping your body, escaping your body, it'll cause a lot of pain and will lead to what's called a sinus block. So this sinus block is similar to what happened in our middle ear during the descent. So we're at our altitude, say we're flying at whatever altitude we're flying at. As we start descending, that gas inside of our sinuses, which can be above your eyebrows or in your cheeks, that gas is going to try to escape. However, because we're congested, that congestion is blocking that gas from escaping, and it's going to cause extreme pain wherever it's located. So say if it's above your head, you can have a really, really bad headache, or if it's in your cheeks, you'll have cheek pain, or it could even lead to tooth pain. With that, another example of this principle is, say if you just went to a dentist and you had a filling, if the dentist actually trapped air inside that filling, as you descend, that same principle, that higher pressure inside of your teeth is going to want to escape, and actually could lead to you popping that filling off if that pressure differential is high enough to break whatever bond is holding that filling together, which also could lead to extremely high pain. But however, for the sinus block at least, if you it could just be avoided if you're not feeling good, if you're congested, if you're having a cold, or if you're congested, upper respiratory symptoms, and you're just not feeling good, just don't fly. Follow the I'm safe checklist. The I in illness, and the first I in I'm safe, or the only I in I'm safe, is illness. So if you're feeling bad, if you're feeling congested, you can definitely expect to have a sinus block when you go and fly. And so in order to not have one, just don't fly with an upper respiratory infection. The next factor that we'll get into is spatial disorientation, which is a lack of orientation with regard to the position, the altitude, and and how the aircraft is in space. So how we come about getting spatial disorientation is because when we're flying in, say, VMC, visual meteorology, if we're flying visually, we have three different systems that we get our sensory from. So that would be like our visual would be the main one that we use. We're looking outside, looking for references, looking for that horizon. We're using our vestibular, which is our inner ear system. And basically what that is that within our inner ear, we have three different canals that are filled with fluid that when this fluid moves, and the filled with fluid with these tiny hairs, and when the fluid passes these hairs, it sends a message to our nerves, it activates our nerves, which then sends a message to our brain indicating how we are. That's the vestibular system. And then the somatogravic or somatosensory system is basically how our body feels, how our joint feels when we're experiencing, based off of gravity and the feeling that we have within our aircraft. It's flying by the sea. You know how you're supposed to be able to feel when you're in a skid or in a slip, when you're uncoordinated. It's that sensory system that plus your visual and whatnot, that allows us to fly by the sea. But all these systems, they all work together and to give us how we are, so that we do maintain spatial orientation, so that we know where we are throughout space. These are the vestibular illusions that we're going to go over, which these illusions come into play when we lose visual reference to the outside, or the outside references can get obscured. So with these vestibular, we have no outside reference. We lost our visual in the set. We've flown into inadvertent IMC. So the first one is the leans, which is one of the most common, and it's caused by a sudden return to straight and level flight during a prolonged turn. And so what will happen is while you're in that turn, the fluid inside your ear, it stops moving it starts to move at the same speed as the inner canal. So you feel like you're straight and level. And so when you go back to straight and level, when you fix the turn, the illusion is going to feel like you're leaning in the opposite direction. And so when that happens, the pilot is going to make the error of going back into the turn. The Coriolis illusion is sort of similar. The pilot is in a prolonged turn for long enough that the fluid in the ears is the same on the outside, same as the Coriolis. But however, during that turn, the pilot will make an abrupt head movement. And sometimes, you'll see this on like a check ride for a private student when they're doing steep turns. They'll drop a pencil, the DP will drop a pencil and be like, oh, pick that up. And then when it happens, if somebody actually does it, or say when you're training and it happens, you pick up and you're all discombobulated. That's the Coriolis illusion. What'll happen is it'll create the illusion of turning or accelerating to a entirely different axis. So the pilot, when trying to correct for this, could put the airplane in a very, very dangerous attitude. Graveyard spiral. The next one is a graveyard spiral. So while you're in a prolonged turn, what will happen is you'll go through the leans. So after you make it straight and level, you'll feel the need to go back into the turn. However, when you go back into the turn, you feel like you're straight and level. But when you turn, because of the loss of lift in the turn, the vertical component of lift, you start to decrease altitude. So what happens is that you think that you're in a steady state descent. But however, when you pull back on the nose, you'll actually increase the turn and enter into a spiral. The next one is somatogravic illusion. And so say if you're on a rapid acceleration, say on takeoff, it'll give you the feeling of tumbling backwards. No, not tumbling back. That's a different one. That's the elevator. No. That's the inversion. So the somatogravic. So say on a rapid acceleration, it'll feel like you're in a nose up attitude, and so when you're in that, you're still straight and level, but you'll feel a nose up, so you'll want to push the nose over. And the same will go for a rapid deceleration. It'll feel like you're in a nose down, so you'll pitch the nose up into a stalling and a high nose up attitude. Inversion illusion is abrupt change from a straight and level flight, from a climb to a straight and level. So you're climbing and then you go straight and level, and it'll feel like you're tumbling backwards. This will also by putting in a nose low attitude. So the pilot will feel like he's tumbling backwards. He thinks he's high, so he'll put the nose over to counteract. And then the elevator illusion is an abrupt change, abrupt upward vertical acceleration. So then, like an updraft, and it'll create the illusion of being in a climb. So then the pilot will put the nose in a nose low attitude, and the same is reversed. So if he's in a downdraft, in an abrupt rapid vertical descent, he'll put the nose in a nose high attitude. The next type of illusions are your visual illusions. So this is where you come across obscure horizon. So so for your false horizons, it'll be like, say, a sloping cloud formation, or say you're like in the JFK accident, he was flying in a pretty unlit area, and what happened is he couldn't find the horizon because of, like, say, stars. He thought the stars were ground lights and vice versa. And so what happens is that it'll create the illusion of a false horizon, and the pilot will try to attempt to put the airplane in what he thinks is the right attitude for a straight and level flight. The next one is autokinesis. So say you're flying at night and you see a light, and then that light starts to move. After staring at it for a long period of time, it'll start to move. And what will happen is the pilot will move the aircraft based on the perception of that light and where it needs to be. So how to cope with spatial orientation. The number one thing is to rely on your instruments. That is the number one thing. You must trust your instruments and not your sensory. You're not your sensor systems. So another thing is you can understand the causes of the illusion, what causes them, why the leans happens, why the Coriolis illusion happens. You can understand you can obtain weather briefings so that you can try not to fly into inadvertent IMC, which is where these illusions happen the most. You can maintain proficiency and get training in flying with reference to the instruments. You can don't fly into adverse weather. Use reliable outside references. If you're flying visually, make sure you know that's the horizon and not a false horizon. Don't use sudden head movements, even if you're trying to look out for collision avoidance or something like that. Try to, just use your eyes to move and not your head, which will, change the fluid inside your inner ear and could cause illusions. And just be physically fit to fly, maintain good health, as well as, a good diet, good rest. And, the number one thing, though, is being proficient in instrument, or being proficient in flight by reference to your instruments, or just not entering into IMC. So the next one, these are illusions that will occur, say you're flying in IMC, you're flying with instruments, and these will occur mostly during your landing phase after conducting an instrument approach procedure. What will happen is that because of how the runway is, or how the other geographic conditions or atmospheric conditions around the airport can create these types of illusions. So the first one is the runway width illusion. So if you're coming into approach at a narrower than usual runway, it'll seem like you are higher than you actually are, leading to a lower approach. If you are flying, and the same is for a wider runway, if you are flying on a wider runway, it'll seem like you are lower, leading to a higher approach. The same thing is said for the runway slope illusion, which is if it is an upsloping runway, it'll seem like you are higher than you actually are, leading to a lower approach. And the same is, and this is vice versa for a downsloping. So if you're if you're flying into a downsloping runway, it'll seem like you are lower than you actually are, leading to a higher approach. So a black hole approach is the next illusion. So say you come out of the clouds and you're flying over water. There's not a lot of light around the airport, which will make you seem higher than you actually are, and then make you fly a lower approach. So water on the, say if it's raining, water on the windscreen will make you seem like you are at a greater make you seem like you are higher than you actually are, which will lead to a lower approach. If you're flying into fog, or if you're flying into haze, it'll seem like you are flying at a greater distance than what you actually are, which could result in flying in a lower approach. And the same is opposite. If you're flying on a clear, bright day, you seem like you are closer to the runway than you actually are, which will make you fly a higher approach because you think you are closer. Fog, if you if you descend and you're in fog, come out of the approach and you're in fog, it'll seem like you're pitching up, which will make you if you're not notice it, make you start a sharp descent. And if the ground light illusion, if lights are on a straight path close to the runway, you might think that is actually the runway instead of what it actually is. Or say if there is no lights around the runway, there's just one bright light that is, like say the approach lights are very bright with little lighting around it, it can make you seem like you are closer to the runway than you actually are, which leads to a higher approach. And these are just I was going over the runway illusions. So if you have a higher or a wider than usual runway, you'll fly a lower approach, or you'll think you're low, leading to a higher approach. And the same goes with the opposite for an error of an upsloping. You think you're higher, leading to a lower approach. And the same is opposite for a downsloping runway. And then to prevent these obstacle illusions when you're landing, you want to make sure that you can anticipate the possibility of these illusions. You want to make sure that you look over the the lights, the slope, the width of the runway. If it's wider than you usually are, you can find these things in the chart supplement prior to landing at the airport. You can you want to make sure that if you're landing day or night, you want to make sure you're flying at the right altitude, especially if you're coming off of an instrument approach procedure. You want to make sure you reference that altimeter and make sure you're not flying too low or too high. If there's a VASI or poppy, definitely follow that in. That'll for sure keep you and help prevent these things, as well as using the VDP on a non-precision approach, which is the visual descent point. This is where the aircraft can descend visually using references, as long as they can using visual references around the airport. And then just know that if you do come across one of these illusions, an accident can increase during this, and as well just maintain proficiency during landings will help you counteract these illusions. The next factor we'll talk about is motion sickness. So it is when your body and your brain are sending conflicting messages about the state of the body. So what'll happen is say if you have increased anxiety or stress, it can help contribute to motion sickness. And it's just your body is just confused. It's in a state of confusion. It doesn't know what's going on. Some symptoms, you can be just generally discomfort. You can have some nausea, dizziness, paleness, sweating, and vomiting if it's really bad. And this is, even if you're a pilot, this is not a statement of how bad of a pilot you are. Everybody can be affected by motion sickness, especially newer pilots. And say if you were training a newer pilot, you wouldn't want to go up in turbulent air, which would increase motion sickness, and you wouldn't want to start off at shorter intervals of training. And then as you get more used to the motion of the aircraft, increase your training periods for longer. In order to counteract this, what you would want to do is you don't want to open fresh air. You want to get fresh air into the cockpit. You would want to look and focus outside of the aircraft and like references on the ground references. If you're able to, you would definitely want to focus outside the aircraft, and you would want to not make any necessary head movements while you are feeling any discomfort. Another factor that affects pilots, this is a very, very dangerous one, is carbon monoxide. So the problem with carbon monoxide, which is CO, it's a colorless and odorless gas that is a byproduct of our engine, by the byproduct of the combustion of the engine. However, carbon monoxide is so dangerous is because it is 200 times easier to bond with hemoglobin, which is the blood carrying oxygen molecule, or the oxygen carrying molecule in our blood. It is 200 times more likely to bond with that molecule than is oxygen. So essentially, it is preventing hemoglobin to bond with oxygen, which carries it to their thing, and is a form, as I mentioned earlier, of hypemic hypoxia. What happens though, however, how this can occur in the aircraft is because in our aircraft, what happens is we take air that comes from outside and it gets put in this heater shroud. And this shroud is basically pipes that come from the engine, their engine exhaust pipes. And what happens is that we use the heat off this exhaust to heat the outside air. However, if there's a leak inside of one of these pipes, it'll leak carbon monoxide, and that carbon monoxide will flow with the air into the cabin when you say turn on the cabin heat or turn on the defrost for the windshield. They also have little placards that you can buy that'll show you when it'll change color when carbon monoxide is in the air, as well as to help prevent this. Also, if you smoke tobacco, you can also get carbon monoxide poisoning, and you can easily be more susceptible to this the more you smoke and the higher and the altitude you go. Some symptoms can include definitely a headache, blurred vision, dizziness, drowsiness, and a loss of muscle power. And because it's a type of hypoxia, you can experience that euphoric effect as well. Because you don't have that oxygen going to your body. To prevent this, you want to turn the cabin heat off immediately because there's a leak. That's where it's coming from. You want to open up fresh air so that you can get more oxygen in the cabin, fresher oxygen, fresher air, and as well as you want to use supplemental oxygen if you have it available. Next thing that pilots can really affect performance is fatigue and stress. Stress is the body's response to the physical and psychological demands that it is placed on in everyday life. What can cause these things are what's called a stressor, and that's anything that can create that stress in our life. There's two different kinds of stress. There's acute stress and there's chronic stress. Acute stress is just immediate threats that are perceived as a danger to the body, and it comes off as the fight or flight response to stress. It'll create that, and a good response to this type of stress, it is not gonna affect too much of the day-to-day. However, chronic stress is not something we like to see because it is a level of stress that presents an intolerable burden and exceeds the ability of an individual to cope and causes the individual's performance to fall sharply. It is not something you want to mess around with, and it is built upon it comes upon the stresses over time. And the only way I mean, if you're dealing with this, probably the only way that you can do this, because it's been built up for so long, is to consult a state licensed physician. Acute stress, you just want to, in order to stop that, you want to, get a good night's rest, eat as well. So fatigue, it goes hand in hand with stress, because fatigue is associated with, it is associated with pilot error and include degradation of skill. And fatigue is the body's reaction to that stress. It gets tired, and there's two different types. There's physical and mental. And there's also two different types of, it could be physical or mental fatigue, and two different types of fatigue, as well as acute and chronic. Acute fatigue is short terms and occurs in everyday life. There's two different types of fatigue. There's two different things that could result. There could be a timing and disruption. So like, say you're flying an approach, and you usually do the before landing checklist 2 miles or 5 miles prior to the final approach fix. However, when you're flying now, you do it at the final approach fix. You're doing things, but it's in a delayed manner because your body is just so very tired. Another one is a disruption of the perceptual field, which is concentrating visually on just your center view and not seeing the peripheral vision, or the things happening in your periphery. The causes can be, mild hypoxia, physical and psychological stress, depletion of physical energy resulting from psychological stress, and then sustained psychological stress. And it'll happen every day to day. How to fix this is to have a good diet, get good rest, and come back the next day. Move on. You want to, and these things help with fatigue for sure. Chronic fatigue, however, is a little different, because chronic fatigue is a series of acute fatigue built up over and over, and it is stress that extends a long period of time, and it is produced by high levels of it. Some symptoms would be weakness, tiredness, palpitations of the heart, breathlessness, headaches, or irritability, and can lead to, and actually it could lead to emotional illness. And chronic fatigue, it's really hard to come back, because you're just so tired of everything happening over and over and over again, and your body is just tired. So there's not really a day of rest you can get, or a good diet that'll fix it. You really just need to as well talk to your state licensed physician about chronic fatigue. The next factor is dehydration. It's pretty self-explanatory. It's a loss of water in the body. Some causes, if you're not hydrated, you can be on a hot flight deck, or a hot flight line. You could, be flying with that direct sunlight hitting you. It could be really hot. You could be losing, sweating, or drinking diuretics, which is a drink that flushes out the water in your system, like coffee, tea, alcohol, and like caffeinated drinks. Some symptoms, if you don't have enough water, which is what our body is like 70, it's like some certain percent. It's mostly what our body is made out of, and what we need really a lot in our life. Some headaches, or some symptoms would be headaches, fatigue, cramps, sleepiness, and dizziness. And as long as you are dehydrated, it will increase your fatigue throughout the day, because you don't have that have the nutrients that you need. And some solutions would be to drink 8 glasses every day, which translates to 2 quarts every 24 hours. That's a good recommendation of what you should be drinking every day. And what you don't want to do is, when you get thirsty, when you get that, oh, I need to drink something, your body, it's actually that thirst mechanism is too late. And what will happen is, say you just take a couple of sips, you don't drink as much as you need to, that thirst will actually go away, and you will still be needing a lot more water in your body than you have to have. Um, and also, just limit what you're drinking, limit caffeine drinks, limit the alcohol, limit the teas. Coffee, you kind of all need coffee, but just make sure if you drink coffee, you're drinking water to replenish what you're gonna lose. The next thing is, we're gonna talk about is alcohol and drugs. Alcohol is it basically it impairs the efficiency of our body. And what'll happen is, say when you drink it, it just is a toxin. It's what it is. It's actually considered a depressant drug. And what'll happen is some symptoms you can see, and with just a little bit amount, you can see impaired judgment, decreased sense of responsibility, defective coordination. It can construct your visual field. It can diminish memory, reduce reasoning ability, and lower the attention span. And say if you had those things in a cockpit, the effects of flight safety would be that, like, safety of flight would be out the window. There would be no safety of flight. You wouldn't be able to do this, even with a 0.04, which is regulations. It's not a good idea, to be drinking and flying at the same time. And even as you go up, remember, this leads to a type of hypoxia, which is the histotoxic hypoxia, which is, hypoxia, which affects our blood cells, which will stop our blood cells to effectively deliver oxygen to our body. And what will happen is that even while you increase in altitude, it's gonna increase the effects of alcohol. And people are like, oh, I'm good. It's been 8 hours bottle to throttle. I'm below less than 0.04, which is the regulations of what you can do and still go fly after you've been drinking. The problem is that even the regulations say that if you cannot feel the effects of alcohol, well, people with a hangover, they're like, oh no, I'm good. But you can still feel the effects of alcohol, and it can remain in your body for over 16 hours. And you could still be considered, you could still have those symptoms while you're hungover. And so, for example, this chart here, it shows that it gives us like the alcohol percentage of the blood alcohol content. So like, say if you're 0.01 to 0.05, you're going to have an average individual, and they're going to appear normal, which is why 0.04 is pretty still kind of high, especially if you're dealing with passengers and you're getting paid to do it. It's not a good mix. And say even at a 0.03 to a 0.12, you can experience mild euphoria, talkativeness, decreased inhibitions, decreased attention, impaired judgment, and increased reaction time, which those things in a cockpit do not go well together. And this also goes with drugs. So virtually all medications, they have the potential for adverse side effects. And I was thinking to myself when I was making this PowerPoint, I was like, I always forget that, even over the counter things that you take, like an aspirin, are considered a drug, even though most people think of drugs as being like, illegal drugs like weed or narcotics or something like that. That is definitely not what you're allowed to have inside the airplane. But even part 61, 53, and 91, 17, these regulations state that if you take, say, a medication that you think or is known to affect the safety of flight, you're not allowed to take that medication. Or if, say, you take a medication that will not allow you to fulfill the medical requirement, you're not able to fly or act as a required crew member during the flight. And even taking like over-the-counter drugs can even have adverse side effects, like say antihistamine or decongestants, and these things even can cause drowsiness and cognitive deficiency. So and even a little bit. You want to make sure that, even if you're taking over-the-counter drug, you wait like 48 hours to see if there's any side effects that can affect you before you go fly. And any medication that depresses the nervous system, like a sedative or a histamine, can make a pilot more susceptible to hypoxia because you're drowsier, and able to function as well. And so analgesics versus any I can't even pronounce it. Any anesthetics are basically painkillers. You don't want to take any painkillers. Analgesics are stuff like even are stuff that reduce the pain, or and then anesthetics are painkillers that numb the pain where it's at. And so like you'll see anesthetics, and like when you go to the dentist, the laughing gas, that's an anesthetic. Your analgesics could even be over the counter drugs like ibuprofen or Benadryl. But even though if you say those are fine to take as long as there's no side effects, but if you take like say a prescribed like codeine, analgesic or painkiller, those as a no-go. You cannot fly with codeine unless you get prior permission from the FAA. But definitely probably won't let you do that. Stimulants versus depressants. So stimulants are caffeine, something that activates the nervous system, while depressants are something that depresses the nervous system, like alcohol. Those things can affect flight, and as well as went over to alcohol, it's not good for safety. Stimulants, can increase reaction time and stuff like that, but have negative side effects as well associated with them. And then even antibiotics, they can have side effects as well. You just don't want to make sure you don't take any medication that can, or when you do take medication, you want to make sure that you don't have any of those side effects when taking them. And see, these are the types of like even substance. So like say, this goes over like the substance, say alcohol, which you can get in like beer or liquor, and the possible side effects: impaired judgment, reduced reaction time. Say nicotine, which is a stimulant. You can get them in cigarettes or vapes. The side effects could be sinus respiratory systems, which goes back to say your middle ear and your congestion problems. As well as hyperventilation, not good things. Caffeine, which is a stimulant, impaired judgment, reduced reaction time as a side effect of it. Sleep disturbance, because you have an increased heart rate because of it. And you just want to make sure that you're not taking anything or doing anything that's going to affect the safety of flight. And as well, the safest rule is to not fly while you're taking any medications, to avoid alcohol or drugs. Or unless they're approved by the FAA, of course, and you have no side effects. But and all these medications that you're taking, you can find a list on the AOPA. They have a list of what's approved and what's not approved that's allowed for your medical and what's not. That you can go on and look. And before every flight, you want to make sure that you go through what's called an I'm safe checklist, which you want to make sure there's no illnesses, there's no medication that's going to affect you, there's no stresses and that's going to affect flight, that there's no alcohol you've been drinking, 8 hours bottle throttle, 0.04% less, and not feeling the effects. Any fatigue, you want to make sure you're not fatigued. Have you got enough rest? Are you eating good diet? And then E would be any emotional states, or have you ate? Make sure you eat and make sure there's not anything emotional that's going to affect you during your flight. And every pilot should go through that check prior to flight to make sure that they know that they're safe to fly. And if you're taking like say over-the-counter drugs, you want to wait before you fly. You don't want to take any unnecessary or elective medications if you want to continue flying, because those things are a no-go, especially if they're not approved by the FDA. And eat a balanced diet, maintain hydration, stay well rested, and just be physically fit to fly. Just don't do drugs, and if you take medication, just be careful. And then this is what's called altitude-induced decompression sickness, which is short for DCS, also known as the bends. This is kind of funny because when they didn't know what was happening when this sickness, people used to bend over and then like, oh, he got the bends. What happens is that due to the exposure of low atmospheric pressure, nitrogen in our body, which is absorbed in our body, will cause these gases to come out of the physical solution, meaning come out of the body. And what will happen is bubbles will form where they're trying to escape, and then it'll be bubbles on your skin. So say if nitrogen is forced to leave your body or your solution, your physical solution, too rapidly because of the lower pressure in the atmosphere, these bubbles will form on your thing. And this goes, that is just altitude sickness, but this is very, very important when you're talking about scuba diving, because what happens when you scuba dive as well, nitrogen is because when you're under the water, your pressure is increased is a lot more than when you're at sea level because of all that water is on you. So when this happens, this increases the rate at which nitrogen is absorbed in your body when you breathe in. And so what will happen is because you have that so much oxygen, it takes a longer time for it to dissolve out of your body naturally, because it naturally dissolves out of your body. And so, however, if you went and flew, you could really expect DCS to happen because you have so much of that nitrogen, and it's going to want to leave your body already because you have so much excess, and that low atmospheric pressure, that gas is going to dissolve, and it's going to want to form bubbles on your skin, and it is not good. Very, 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 very painful. How they recommend this, say you went scuba diving, if you're flying above, and these are MSL, this is not cabin pressured altitude, this is your MSL, above the sea level. If you're flying above 8,000 feet and you went you want to wait until 12 hours after dive that was unassisted, so you didn't have to stop in the middle for your body to equalize in pressure when coming up. If you did have to have an assisted ascent, you want to wait at least 24 hours. And if you're going above 8,000 feet, no matter if it was assisted or not, you want to wait 24 hours before you go fly. And say if you come across this situation, what you want to do is you want to don an oxygen mask as soon as possible. This will increase the amount of oxygen in your body, as well as you want to start an emergency descent and landing as soon as possible, so that person can try to get into a hyperbolic chamber so that they can counteract the bends. And as well, if what'll happen is that usually this is caused around joints, and so if you feel joint pain, don't move it. Don't try to move the bubble around. That'll just make it worse and even more painful. And as well as once you land, you want to seek medical assistance as soon as possible and try to enter a hyperbolic chamber so that they can try to save you and fix the pain that you're in. That's it. I got most of this information off of the PIEC. If you want to go into it more, feel free to look into it, chapter 17. And if you have any questions, comments, or concerns, please let me know. Thanks.